Well, good night. I'm Eric Nera and I'm gonna talk about fixing healthcare delivery. There have been a lot of medical errors. It means that if you or a loved one needs medical hospitalization, you're gonna have 1 out of 10 chances of suffering a medical error. This kind of medical errors are now in the 3rd place as most common cause of death in the USA. Here in Ecuador, we have to say that we also have a lot of medical errors. But first, we have to learn to recognize the problems to fix them. Here we have a little case about a woman named Mary. Mary was a woman who suffers of severe pain under her right knee. She can barely support the feeling of a blanket. When she went to the doctor, he prescribed just painkillers, without any exams, without nothing. Then, after a few days, she went to a neurologist, and he said that she has compromised 2 peripheral nerves. Maybe that happened during an exercise, maybe aerobic dance. The neurologist said that it will heal in approximately 1 year, but the pain continues, even it gets heavier. What do we know about compression of peripheral nerves? Let's see a little video about it.
Hello, I'm Alex Mauska. I'm a neurologist in New York City, and I'm the director of the New York Headache Center. Nerves cover the entire body. There is no spot in your body that doesn't have nerve endings. That's why we have good sensation. You touch someone, you feel the touch. And so there are two major kinds of nerves. One is the sensory nerves that allows you to feel things, heat, cold, touch. And there are other nerves that move your muscles. That is, nerve comes from the brain through the spinal cord and to the muscle, and the muscle contracts. So your brain has to give the order. So nerves can be damaged by a variety of conditions. It could be an inflammation of the nerves. There could be compression of the nerve, which often results in a painful condition called neuralgia. Inflammation of the nerves often occurs due to viral infections, or sometimes for no apparent reason. We sometimes cannot diagnose why some people have what we call peripheral neuropathy. So peripheral neuropathy can occur from well-known conditions such as diabetes, can cause peripheral neuropathy. Alcoholism can lead to deficiencies that in turn can cause nerve damage. Deficiencies in vitamins such as vitamin B12, thiamine, and other vitamin deficiencies can cause nerve damage. Nerve damage can occur from pressure during surgery or from sleeping on your arm when you're drunk. We have a funny term for that. When you have pressure on this nerve and you sleep on the bench, we call it Saturday night palsy. People often drink too much and they fall asleep on the bench and they exert too much pressure on the nerve and they have difficulty moving the hand. Usually that recovers pretty quickly.
Continue with this case. Mary, after a few days, some blue blisters appeared under Mary's fingernail. She went to the doctor, and the internist looked at her, made some exams, and diagnosed thrombophlebitis. And he said that she needs to be hospitalized. The blisters don't matter to the intern, even if the lab exams were altered. At the 5th day, suddenly Mary started saying that she was feeling some right chest pain, and then she coughed blood. What are blisters?
The mechanism of injury for foot blisters is poorly understood, so here's a short 2.5-minute video to show you exactly what they're all about. Everybody knows blisters are caused by friction, but then most people think friction is rubbing, which really it isn't. Blisters are a result of shear. So what is shear? Well, take a look at this wobbly box. Something's trying to move it, but it's not moving. It's stuck to the surface it's sitting on. The reason the box is staying put is because of the force of friction. Friction is the stickiness or slipperiness between 2 surfaces. The friction here is high enough to keep the box in place, in spite of the movement force trying to push it along. But the box does change shape as a result of the movement force. It distorts. This distortion is called shear, and it is shear that is the damage by which blisters are formed. So what are the two main points here? Firstly, friction is not rubbing. In fact, high friction is what's keeping the box stationary. When it comes to foot blisters, high friction exists in exactly the same way to keep the skin, sock and shoe stuck to one another so they don't move relative to one another. And lastly, shear. Shear is distortion. Elements within the wobbly box stretch and distort as a result of the forces applied. If this was the foot, the movement force would be from the bones at the top of the box as they move back and forth with each step. And the middle section would be the layers of skin and soft tissue, tissues that are quite capable of stretching and distorting to a point. If stretching and distortion is excessive, elements within the wobbly box's structure will break. If shear is excessive in magnitude or frequency, damage occurs. Of all the soft tissues within the wobbly box, we're talking the layers of skin, subcutaneous fatty tissue, ligaments, muscles, fascia, etc. The zone of least resistance to shear is the stratum spinosum of the epidermis. Microtears develop in this layer and fluid fills the void created. So this is what blisters are all about. I hope this has helped you understand a bit more about friction and shear and how these forces contribute to blister formation.
Well, during new exams appears that Mary has an pulmonary embolism and she needs an umbrella in the femoral artery. But the doctor just said the heparin is on underdoses, and that was the reason why Mary suffers that pulmonary embolism. What is heparin? What do we know about that?
So we're going to continue straight on from the last video detailing how the coagulation cascade works. Heparin is a cofactor for the activation of antithrombin. This acts on many points in the coagulation cascade, inhibiting factors 12, 11, 9, as well as 7 and 2A thrombin. So you can see it works on all parts of the coagulation cascade, the intrinsic, the extrinsic, and the common pathway. Heparin has a quick onset but a short half-life, so it is most useful clinically for situations where you require immediate anticoagulation, for situations such as a pulmonary embolism, acute coronary syndrome, a myocardial infarction, or deep vein thrombosis. However, it is also used in pregnancy for anticoagulation because warfarin cannot be used in pregnancy as it's small and crosses the placenta. When you give heparin, it is useful to monitor the PTT or partial thromboplastin time. Side effects of heparin include bleeding, obviously, and thrombocytopenia, osteoporosis, and other drug-drug interactions. An important kind of thrombocytopenia caused by heparin is called heparin-induced thrombocytopenia, HIT, where you get development of IgG antibodies against heparin, binds to platelet factor 4, PF4, and together this complex activates platelets and causes thrombosis and thrombocytopenia. The good news is the effects of heparin can be reversed with an antidote, protamine sulfate, which is a positively charged molecule that binds negatively charged heparin and takes it out of the system. Nowadays in hospitals you'll find that standard heparin is now mostly replaced by low molecular weight heparins such as enoxaparin and dalteparin. These will act more on factor 10A than standard heparins, and they also have a much longer half-life, up to 2 to 4 times longer, and thus a greater bioavailability. The benefit of this is that they can be administered subcutaneously and don't need to be monitored with the laboratory. However, they aren't as easily reversible as standard heparin, and thus you cannot use protamine sulfate in situations where you require rapid reversal. Another important anticoagulant that you need to know about is fondaparinux. This is very similar to low molecular weight heparin, but it's actually a synthetic pentasaccharide factor 10A inhibitor. These are all drugs that a junior doctor will be prescribing frequently, so it's useful to become familiar with dosages and treatment regimens. Enoxaparin is generally given as 1 milligrams per kilogram subcutaneously, 12 hourly. The dosages of fondaparinux depend on the patient's weight. For patients weighing less than 50 kilograms, one would normally give 5 milligrams subcutaneously a day. For patients weighing between 50 and 100 kilograms, one would give 7.5 milligrams, and for patients weighing 100 kilograms or more, one would give 10 milligrams subcutaneously every day. Generally, with the use of anticoagulants, the important thing to remember is to monitor the patient's INR and to keep an eye out for heparin-induced thrombocytopenia.
Two days later, Mary suffers a little heart attack. She was transferred to the cardiothoracic intensive care unit, where she spent the night. The next day, she was with a full oxygen mask. Then she got intubated, hypertension, kidney failure, and she got treated with corticoids. She suffered another heart attack, and 2 minutes later, she got read again. What is kidney failure? And what happened if we had kidney failure?
Kidneys are a pair of about 12 centimetre long bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has 2 kidneys, which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have 3 important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumour or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the functioning of the rest of the body. If you're suffering from a kidney disease, kidney failure can occur. In that case, your kidneys are not able to filter waste products and fluid adequately from your blood and extract them from the body. When the kidneys don't function properly, you might have the following symptoms: fatigue, nausea and loss of appetite, skin itching, high blood pressure, difficulty in concentrating, difficulty in sleeping or excessive sleep, shortness of breath. If the kidney functions can't be restored and both kidneys fail, then dialysis is needed. It is necessary if the function of the kidneys is less than 10%. The function of your kidneys will be performed artificially. There are 2 major types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, your blood is filtered through a dialysis machine outside your body. In peritoneal dialysis, a dialytic fluid is flushed through your abdominal cavity, extracting the waste products from your blood. An alternative for dialysis is kidney transplantation. You get a healthy kidney from someone. Your general practitioner can give you more information about the disorder and its possible treatments.
When she suffered the 3rd heart attack, something changed. Her kidneys started working. She dropped out 4 gallons of fluid and her lungs were clear. She was fully recovered. That was a miracle. Summary of the case. She had 2 peripheral nerves damage, thrombophlebitis, pulmonary embolism, 3 heart attacks, kidney failure, fluids in the lungs, and all this just for a medical error. Quality. Quality is reliability, critical for healthcare. Durability. Aesthetics. Aesthetics. What is aesthetics? Aesthetics contains the lobby of the hospital, decorations, and performance. We have 6 dimensions to work on. Safety, that reduce risks. Effectiveness, that all the personnel of the hospital just work in a perfect harmony. Patience, patience also for the patients, and patience also for doctors and nurses. Timeliness, everything should be on a schedule, but in the schedule we also have to give the patients the time we need. Efficiency, stop wasting things. If we have something, we have to learn to work with that, not just throw it away because we don't like it or something like that. Equally, it is the same for everybody. Other points to improve: manufacturing, teamwork, preventing human errors by practicing under the worst situations, and becoming a leader, organizing people. How is the teamwork in a hospital?
Perhaps more than any other factor, the increasing complexity of healthcare and reliance upon technology has increased the risk of things going wrong. The time has long passed when a physician could effectively manage all the aspects of a patient's care. Modern medical care requires input from a wide variety of personnel with special expertise. But expertise alone is not enough. Effective and efficient care requires that individuals' efforts be coordinated and complementary. In other words, we must work as a team. This is why it's critical that we address human factors in the delivery of care. Teamwork not only increases effectiveness of care, it also increases safety and quality. Having a clearly defined role, understanding the care plan, having input into the process, and being valued for one's unique contribution lead individuals to perform better in team environments and make fewer mistakes.
There have been a lot of medical errors here in Ecuador, but now we all have the laws. We are trying to change these kind of things. Well, thanks for watching.